Good morning, everybody. Welcome to lesson number 2. How is everybody doing? I noticed that many of you were really excited. The first lesson got you excited. Remember that we just started. So what we have done was just an introduction. And if introduction was that excited, what do you think will happen when we start the real deal? So again, so I am very happy, very excited so far, and I want to thank you. So lesson number 2 is what we are in for. So this lesson number 2 is very important. It is the foundation of the course. Remember that we're still talking about first aid. First aid is the basic care you give to a patient who is ill or injured. We have defined that enough. In the first lesson, we saw the roles or the objectives of first aid. 3 P's: preserve life, prevent more injury, promote recovery. We also saw the 5 obligations of the first aider, first aid provider, first aider. So the 5 obligations: make sure that you use reasonable skills. Make sure you don't go outside the scope of first aid. Make sure that you obtain permission from your patient before you start. Permission could be voluntary or implied. Lesson 1 covered all those. Don't abandon your patient, and make sure you protect the privacy of your patient. Very important. First lesson 2, we covered Good Samaritan law, which is the law that protects the first aider from liability. So for you to be adequately protected by Good Samaritan law, you must fulfill all those obligations. So lesson number 2, we will try to extend the good job that we have started already. Okay, so please take your writing material and write down important points. So this is the foundational to the course. So this lesson, the lesson number 2, remember that we are here to learn together. And the reason why we're here is to boost our confidence through knowledge acquisition. And by doing what you're asked to do, I am very, very sure that by the time we finish, we'll have gone with a lot of knowledge, and your confidence would have been boosted. So lesson number 2, and lesson number 2 is going to center on emergency scene management. Okay, emergency scene management. So emergency, okay, scene management. So those are the 3 words in our topic, emergency scene management. So what is emergency scene management? When you do first aid, you do a lot. Series of activity from start to finish, from A to Z. So from A to Z, or from start of the first aid to stop. So there are activities in between the start and the stop. A lot of activities geared toward making your patient better. So those activities, you can actually describe them within the framework of ESM, Emergency Scene Management. What is the definition? So emergency scene management is a series of activities the first aid provider engage in as part of first aid to help the patient, and the central objective is to lessen the impact of emergency on that patient. So emergency scene management comprises of all the series of activities you do during first aid to lessen the impact of emergency on the patient. So that's what emergency scene management is about. Series of first aid activities. First aid comprises a lot of activities. Okay, so emergency scene management comprises a series of first aid activities aimed at lessening the impact of emergency on the patient. So that is the global, the broad definition of emergency scene management. Emergency scene management, series of first aid activities aimed at lessening the impact of emergency on the patient. Emergency has impact on the patient. So whatever you do, that the purpose is to lessen, to minimize the impact that the emergency has on the patient. Remember that if you don't do anything, the impact will begin to widen. The impact will begin to escalate, begin to aggravate, begin to increase. It progresses. Emergency will leave somebody in a progressive state of, worsening impact. Okay, so the impact could be many, depending on the nature of what the emergency is about, the nature of the emergency. So it becomes necessary for us to lessen the impact, and everything you do step by step and the target is to lessen the impact of emergency on the patient. That is what we call emergency scene management. So you can also see it as a step-by-step way of providing first aid. So that's another definition. Step by step way of what? Providing first aid. Let me know, please. If you have any questions, step-by-step way of providing what? First aid. So, step-by-step way. So it's an algorithm. So you follow some sequence of activities. So some sequence of activities. Of course, these activities are what? First aid activities. Okay, again, those are some other way to define emergency scene management. Very important, very fundamental to the course, and understanding this is very important. So there are 4 sequences, there are 4 broad steps that, that make up emergency scene management. So emergency scene management comprises of 4 sequences or 4 broad steps. So 4 broad steps. Okay, 4 broad steps. Okay, step number 1, okay, is called scene survey. Scene survey. Okay, scene survey. Okay, step number 2 is called primary survey. Primary survey. Step number 3 is secondary survey. Step number 4 is ongoing patient care. Ongoing patient care. Okay, so those are the 4 broad steps that make up emergency scene management. So emergency scene management comprises of 4 broad steps, 4 broad sequences. Step number 1, so this is step number 1, which is the starting point. So this is the starting point of first aid. So step 1 is scene survey. Step 2, so this is step 2 here. This is step 3, and this is step 4. So by the time you go through those steps from 1 to 2 to 3 to 4, you will have achieved the primary purpose of first aid. So you start from scene survey, you make it to ongoing patient care. Whether you're going to go through all of them depends on many factors. One of them is how long it takes 911 personnel, the paramedics, to arrive. Let's assume that this emergency is a major emergency that requires their attention, and you have called 911 and you start your first aid. So normally you are expected to start with step 1. Start from step 1, and then after step 1 you go to step 2, then step 3, and then step 4. I am very sure that before you finish going through the steps, the patient will have become better. The impact of the emergency will have been lessened, which is actually the primary objective of emergency scene management. So in the coming lessons, I will try to look at each of these steps in more extensively, but I'm going to give a very quick overview of each of them. I don't want to go details. I don't want to go into details. I will keep it broad overview at the broad overview level. So scene survey is where you start. And what is scene survey? This is where your primary focus here is your safety. So remember, when I say your safety, I mean the safety of the first aider. The first aider is the person who is helping the patient. So you want to be sure that there are no hazards. Remember that a hazard is anything that can harm or anything that can kill. Hazard can harm, hazard can kill. So during scene survey, your primary objective of doing scene survey is to scan the area, making sure that your safety is guaranteed. You also make sure that your protection is guaranteed. Protection is everything you do um, to prevent transmission of disease. So all those you take into consideration during scene survey. Another thing you do during scene survey is to obtain permission. Okay, so there are other things you do which we're going to cover in the next topic. Primary survey is when you now look at the patient. Okay, you look at the patient, you assess the patient very quickly. So primary survey, you assess the patient rapidly. It's a rapid assessment of the patient. And while you're assessing the patient rapidly at this time, you want to determine if this patient has life-threatening conditions. If the patient is actually in any life-threatening conditions. So, and this is very, very important, is the key to knowing the way forward. So, in our lesson number 3, we're going to cover more about this. So we're going to see RABC assessment. So you assess the patient R, you assess the patient A, you assess the patient B, you assess the patient C. R means responsiveness, A way is A, B is breathing and circulation. So you assess those 4 areas, and then the outcome of that assessment will have let you know if that is life-threatening emergency you are dealing with there. Okay, and then in the lessons to come, I'm going to talk more about this. It's very key, very important. Secondary service, when you look at non-life-threatening injuries. So when you assess the patient for non-life-threatening injuries. Okay, so that is secondary survey. We're also going to see more activities, what you are expected to do as a first aid provider when you come to that stage. When you reach that stage, what are you supposed to do? Ongoing patient care is when, let's assume you have done everything you need to do from start to that point, and EMS has not arrived, so you shouldn't leave your patient, you shouldn't abandon your patient. Okay, you need to stay with your patient, you need to continue reassuring, monitoring your patient. Those are some of the things you do. Any other manual support you need to give to your patient, you have to do that at that point. So, but the point here is that you shouldn't abandon your patient. So, emergency scene management is an algorithm you follow. This is the recipe you follow. It's a guideline, step by step. Start from step number 1, and then go to step number 2, and keep on going until step number 4. I am pretty sure that EMS will meet you at some point, and then you give them report what you have done, what you are yet to do, and then you formally hand over to them, and they will carry on from there. So this is emergency scene management, very important. Does anybody have question? Okay, there's no question. Thank you so much. And then, just as I promised, I'm going to look at each of these. Each of them will take separate lessons. So when we get them, I'm going to expatiate on this. I'm going to throw more light, tell you what specific activities you need to do in each step, working your way toward step number 4. So thank you so much, and please, if you are watching this, why not give us a thumbs up, put your comment, and you can share that as well. This is the way you can promote this channel, promote what we are doing. Thank you so much, and I'll see you anytime soon. Bye-bye for now.